Hello everyone, so I thought we would have a bit of chat about using one of these. This is called a Compex and it is a muscle stimulator. So what is a muscle stimulator? It's exactly what it says on the tin. It helps basically use an electrical impulse to stimulate muscles. So when is it useful sort of in the MSK practice? The big one for us is we use it for part of the rehab process and particularly post-op rehab. So it can be used when you've got to try and protect that surgical site, but you don't want to try and lose too much strength through the surrounding muscles. So the beauty of the Compex, you can get the muscles to work without having to put the load for a joint, for example. Or one of the most common reasons we use it is if anyone's had an Achilles tendon rupture and had it repaired surgically, often what you'll find is that where they've been offloaded for 6 to 12 weeks, they can't sort of plant or flex their toes. So we can actually use the Compex just to help get that range of motion back, which we then find really helps with getting someone back to doing sort of a normal gait type walking, as it were. The other time it can be helpful is people who've had chronic pain and chronic injuries, who've got this nervousness around about using a joint or it's naturally stiffened up, and you can use it as an education tool to show, look, this can move, we can get it moving, and help desensitize that patient. And then it also can be used within sort of the neurological world as well to help stimulate muscles via an electrical impulse. So what will come up next, we'll show you some different videos around how it can be used on the lower limb. It has different settings, so we can basically use it for pain management, you can use it for strengthening, you can use it for muscle atrophy. So I was quickly just going to put these pads on. So these are the pads that we used. So effectively like stick on just like ECG pads, and then use a cable connected direct to the Compex, and then it sends an electrical impulse through. And we can then see that I'm not doing this. This is because it's stimulating, and I can sort of turn it up, adjust how hard it is, and you can then see my fingers curl even more, and then we can then relax it back off so we get hardly in. So that's the Compex, and over the next few videos we'll sort of show how you can use it for different aspects of the lower limb. And it's also a fabulous tool to really focus and learn your surface anatomy as well. Like with using any medical device in clinic, there are some risks and contraindications. The biggest one, obviously, if someone's got a pacemaker, you really don't want to be putting an electrical impulse. If there are any open wounds, open fractures, the pregnancy, just because we don't know how it reacts. They're the big ones that you really don't want to be using it on. Obviously any allergies to the adhesive, but it's a hyperallergenic glue. It's the same stuff they use, say, for ECG pads. The benefits of using it in clinic is to help aid that rehabilitation process and help getting people back to their activity, possibly slightly quicker, or helping them to achieve their goals. Or if you're thinking post-surgery, so you're thinking an ACL rupture, you often find a lot of the professional athletes will be given one when they come out of surgery to start using on their quads, because they can't load their knees, they've got to protect their newly repaired ACL, but they want to try and reduce the amount of muscle wasting they may get from not being active. So they may then still use a Compex muscle stimulator to stimulate the quads without aggravating the knee. So now we're going to look at using the Compex on the lateral ankle. So I really just want you to now start thinking about where are these pads placed and what sort of structures could we now start to work. So now Charlie's going to start applying some electrical current through me, and we can start to see the foot moving. So this is on a muscle atrophy setting, so it basically gives you a pulsing section, and then it will then just do a constant sort of contraction, as it were, for a set period of time, and then you just loop around this cycle for around 30 minutes. So sort of have a think about what is the foot doing, what position is it moving now when it really contracts. Have a look at what's happening around to that big toe joint region, and then what sort of tendon can you really see that's been highlighted along my lateral ankle. So this is sort of using your complex for that lateral ankle complex. So now we are trying structures along the medial leg and ankle. So start thinking about where have we placed these electrodes and what could we be starting to influence. Now, if we zoom in on the foot, start thinking about what muscles we are starting to get working, from what you can see from the changes happening at the foot level. Now, obviously, because it's around the medial ankle, the thing with the complex is if you look at the size of the pad, that electrical impulse is going to go across the whole pad. So you can't just isolate, because of the muscles around the medial leg and ankle, one structure. So look at what's happening to the foot during the pulsing here. Think about what structures could be implemented. And then in a minute now, as we can see, think about what's happening now at the toes as well. And you can start also to see, if we zoom in on that medial ankle, you can sort of start to see the tendons start to become quite visible through the skin. So start having to think about what structures are we working here. So if we now start to think about moving down to foot specific stuff, so start to think about looking at what's happening to the hallux, look at what happens during the pulsating phase, and then look at what happens to it during the long contraction phase. Think about the muscles that could be involved here. Also start thinking about a common heel pain condition that we sometimes find some weakness around this muscle in, with one of the most common causes to heel pain. So as you can start to see, the key to using the complex, especially in the lower limb, is knowing your anatomy. If you don't know where each muscle is or what its action is, you're never going to place the complex in the right position. And because of the size of the pads in the foot, it's difficult to isolate one structure purely on its own just because of the size of the pads. However, I think it all just comes back to that knowing your surface anatomy, and knowing your gross anatomy on textbook is amazing also, but I also think looking how does that anatomy then look on a physical human being, again, is just as important. So here we have it from a different angle. Now just look what happens to the hallux when you get this contraction applied. So now really think about the muscle involved, which is going to cause the hallux to do this. So I thought it'd also be a good idea to show you how it can also work on muscle groups. So I think everyone should really be comfortable where are the electrodes placed on here, and then we can then see what happens to my quads. So I've got no control over that movement, that's just happening because you're getting that long impulse directly into the sort of quadriceps. So I just thought it'd be helpful for you just to see a video of where you can get actually quite a large visible movement, because in the foot sometimes everything is a little bit smaller.
So now, using the complex, we're going to place the pads into the region of the hamstrings, and what you'll be able to see is that when an electrical impulse is presented to the muscle, that we get that hamstring curl effect. So we're getting that contractual phase of the hamstrings that then start to pull the heel to the bottom.